Welcome everyone to our webinar on visual changes and vision impairment with aging. I am Kiese Mpongo. I'll be one of your moderators for today, along with Regan Holmes. She'll be covering or moderating the second half of this webinar. We are pleased to have our public health experts, two of them, Scott Herod and Isabel Steed, joining us as well. So I will go ahead and start with my part of the presentation, first addressing how aging affects the eyes at all. So as a person ages, the lens in their eyes can harden, making it difficult for them to focus. Dry eyes are also another way that aging affects the eyes, especially in women going through menopause. And as a person ages, the eyes will absorb less blue light, which will reduce the amount of melatonin produced. This will then disrupt any normal sleep patterns the person had previously, and this can eventually lead to glaucoma and diabetic eye disease. Okay, so the next question to ask are, what are then normal changes in vision associated with aging? So some normal changes include losing the ability to see up close, having trouble distinguishing between similar colors such as blue and black, needing more time to adjust to changing levels of light, and also dry eyes are another normal change associated with aging. Okay, so some statistics to be aware of in the US that are concerning are that race, ethnicity, and education level all affect eye conditions and extreme to moderate vision loss within aging adults. So for example, with race and ethnicity, studies have shown that 16.2% of older non-Hispanic Black adults reported moderate or extreme vision loss compared to the lesser 11.4% of non-Hispanic white adults. Studies also show that as you decrease in your amount of education level, this can increase your risk for moderate or extreme vision loss. And another study shows that older adults that are experiencing moderate or extreme vision loss are more likely to report diabetes, heart disease, and stroke, and they're less likely to report excellent or very good health. All right, so now we will turn our time over to our two public health experts. First, Isabel Steed, and then next, Scott Herod. They will address us about eye conditions and illnesses. So first we'll hear from Isabel Steed.
Thank you, Kiese. So the first thing I'm going to talk about is age-related macular degeneration, more commonly known as AMD. AMD is the leading cause of vision loss in adults over 65. This is essentially the aging of the macula, which is this region that can be seen on the screen in the image. The main version of AMD is wet AMD, which causes damage to the macula from the growth of abnormal blood vessels. There are two main ways of treatment. There's VEGF drugs, which decrease the growth of blood vessels, specifically in the eye, or photodynamic therapy and laser treatments can be used. On the next slide, there's a brief whiteboard animation, which exhibits the mechanism of anti-VEGF drugs. All right, perfect. So the next thing I'm going to talk about is diabetic retinopathy. This is from complications with diabetes, which causes damage to blood vessels, causing blurred vision, dark spots, and vision loss. Often blood vessels will become fragile and they will leak into the vitreous, causing a buildup of scar tissue. Similar treatment includes VEGF inhibitors, photocoagulation, and vitrectomy. And the final condition I'm going to talk about is retinal detachment. This is where the retina pulls away from the back of the eye, which often causes dark shadows, light flashes, or dark spots. There are three main types: rhigmatogenesis, which is a tear in the retina that causes the vitreous fluid to fill up behind the retina and push it away from the back of the eye. The second is tractional, where the retina will pull away from the formation of scar tissue. And the third is exudative, where fluid builds up behind the retina. There are two main types of treatment for retinal detachment, which are freeze treatment and surgery.
Great, thank you, Isabel and Kiese. Another common form of visual impairment in elderly adults is presbyopia. This is the gradual reduction of the ability to focus on nearby objects. This is caused mostly because the lens hardens and it decreases its ability to focus on close objects. This starts in your 40s and gets worse as you reach elderly age over 65. About 25% of the world's population suffers from this condition, so it's very prevalent worldwide. And common treatment include contact lenses and glasses, as well as adjusting while you're reading by bringing objects closer to your eyes so that you can see it properly. Another form is called vitreous detachment. Again, this is another common cause of visual impairment throughout the world. And in our pre-poll, this was the least frequently identified cause of visual impairment by those that we polled. This is when the vitreous, which is a gel-like substance in the eye, detaches from the retina and causes dark shadows and floaters that can sometimes obscure someone's vision. Now, normally this doesn't require treatment. However, if it does bother you, you can get a vitrectomy, which is where the gel-like substance is sucked out, the floaters are sucked out, and then new gel-like substance or new vitreous is inserted into the eye. In very extreme cases, it can also lead to retinal detachment, and that's where conditions such as blindness can become a big issue. Another leading cause of visual impairment and blindness is glaucoma. This is where increased pressure within the eye damages the optic nerve, and it can lead to blindness. 2.5 million people in the United States suffer from this condition, and it's higher in minority groups and also the elderly. Unfortunately, this condition is not treatable, but it is preventable. And in order to prevent this, you need to have regular eye exams by your ophthalmologist or eye physician. And it's also important that you know your eye history as well, your family eye history. If your family has a history of glaucoma, you're at greater risk of developing the condition. Another common cause of blindness and visual impairment are cataracts. And this is when the lens becomes clouded and it obscures the person's ability to see. It increases with age, and about 94 million people throughout the world suffer from this condition. This condition is not preventable, but it is treatable. And the way that this is done is through surgery, which removes the lens that is clouded and replaces it with a synthetic lens. This video here is a woman in Ghana who was needlessly blind for a significant amount of time because of cataracts. And this is her post-surgery. And I want you, as you watch this video, to see her reaction at being able to see after years of not being able to see or to have her vision.
Like her face. I know it.
So from that video, I hope you can see that many of these conditions have a significant impact on the lives of individuals, and that providing them with treatment or preventative measures can greatly improve their life.
So as we can see from that video, there is kind of a needless, lower quality of life in some cases of blindness. So I'm going to kind of take over now and just talk about some of the consequences of visual impairment. So the first one I want to focus on is that the quality of life is lowered in all domains. So you got environmental, physical, social, and psychological. And as visual impairment becomes more severe, quality of life decreases even worse. And loss of vision, it reduces patients' ability to remain self-dependent and self-sufficient. And the loss of the ability to pursue activities that were casual before, such as reading, hobbies, socializing, etc. It can have hugely detrimental effects on their mental and physical health. So the second consequence I want to focus on is decreased access to care. And there are two major factors that influence access to care. The first one is financial. So many people struggle to afford either transportation to receive care or the care itself, and that's exacerbated by the fact that most jobs do require a visual acuity to be done correctly. And so the second factor that influences access to care is transportation. It's really hard to navigate transportation, private and public, even if you can see well. And so if you are experiencing vision loss, that difficulty is increased, many, many times. So there are some things you can do. If you are visually impaired, there are some things you can do in your home. You can control the glare inside your home by using window drapes and blinds. You can hang mirrors at a level or in an area in your home where they don't produce a glare that goes directly into your eyes. Having adjustable lamps in all reading and task areas, and then making sure the home has sufficiently bright and uniform lighting all throughout the home, especially in hallways and all heavily trafficked areas. So what can we do? The onset of visual impairment is a very, very drastic change in someone's life. Losing the ability to see up close or far away, reading things like prescription labels, street signs, driving. It's a huge change, and it can precipitate, massive feelings of fear and depression. It's very detrimental to mental and physical health. And as far as awareness goes, there isn't much awareness or accessibility for visually impaired people in the world we have today. It is very much built for seeing people, and even though there are continually modifications and advancements in the fields of science, technology, and medicine for visually impaired people, there is still a long ways to go. So we do have a couple of questions from the audience for our experts. The first question is, do you have any stories or have you personally seen visual impairment impact the lives of people? Let's see, do we have an answer from any of our experts?
Yeah, so I can go ahead and answer that question. So first, in answering that question, one of the pre-poll questions that we gave to the audience was, if visual impairment can impact the quality of life of people, and unanimously all of you indicated that yes, visual impairment can, and that is exactly right. I lived in Ghana for a number of years, and one of the most significant experiences that I frequently saw was elderly individuals who were blind, and they had to have their grandchildren take care of them, and their grandchildren couldn't go to school. They had to assist these elderly individuals in getting around town and in getting food, and because of that, these children weren't able to attend school. Ultimately, their economic productivity will decrease, their educational attainment will decrease, and so I saw firsthand that visual impairment can affect not only the individual who is blind, but also their family, and it can further deepen families and communities into poverty. So that's one, specific example that I've seen throughout my career as well.
All right, thank you, Scott. Okay, and then the other question that we've received is, my mom and my grandma have cataracts. Is it a genetic condition?
Yeah, sure. I can provide some insight to that. So there is a partial genetic component to cataracts. So if your mom and grandma both have it, you are more likely to develop the condition, though there are a combination of environmental factors mixed with the genetics.
All right, thank you. All right, so this slide, we have a little quiz for everyone. So just go ahead and pause this video, take the quiz, and then the next slide, we will have the answers for you. And then, yeah, here are the answers. We'd like to thank everyone for watching our webinar today, and we hope we provided you some insight into vision loss in elderly people. We hope you can use the information you learned to go out and make a difference in the world today. And thank you everyone for your time.